there, thank you so much for being here. I'm Dr. Perkins, I'm a board certified OBGYN, and today we're talking about, can weight loss increase fertility? So in this video, we will talk about exactly how does weight affect fertility. We will talk about hormonal imbalances linked with weight or excessive weight. We will talk about what percentage of weight loss may actually improve your fertility, as well as the options that you have to best increase the likelihood of losing weight and increasing your fertility. All right, so let's talk about why weight matters. Weight matters for so many reasons. And when we say weight, we're talking about anyone that's on either side of the spectrum. So those who are underweight or those who are overweight. In both scenarios, our hormones may be impacted by having not enough weight or too much weight. Now, this video is talking about weight loss, so we will focus a little bit more on the person that is overweight or obese. And so in general, when we think about our hormones as females, we have our estrogens and we have our progesterones. Both are being released in our system. We know that the active version of estrogens in a female is called estradiol. Now, there are two other forms of estrogens. There is the estrogen that is found in a female fetus before she is born, estradiol, and then there is another version of estrogen called estrone. This form of estrogen is actually released by fat cells, specifically to fat cells. Now, when we are reproductive, think about this. We have our internal system wherein the brain releases hormones, send messages over to our ovaries, or ovaries will mature an egg and release it. If it's not fertilized, we get a menstrual cycle, and the cycle continues from month to month, every month of our lives. In that process of eggs maturing, more estrogens are being released into the system, into your system. Now, if you also have additional fat on your body, each fat cells are releasing more estrogens into your system. If you were to quantify the amount of estrogens in your system at that point, we have the normal process of estrogens being present, and then we have fat cells releasing more estrogens in your system. Overall, your estrogen picture can be one that is overwhelmed with too much estrogens. Oftentimes we call that estrogen dominance. That means that we have an overwhelming amount of estrogens, and so we will have symptoms of estrogen-like dominance. And so let's talk about what that can look like. In general, estrogens help to thicken the inner part of your uterus. And so I'm going to grab my model here so you can see. This is the vagina. This is the uterus. We have our fallopian tubes, and we have our ovaries. Now, this inside area of your uterus, this is where the tissue builds up from month to month in preparation of a pregnancy arriving. If a pregnancy does not occur and your egg that is ovulated dies, this inner area here will shed and bleed, and that's your menstrual cycle. Now, in the event that you do not ovulate because you have too much estrogens in your system and your ovaries are not functioning, you're not able to mature an egg, you're not able to release it, what happens is that the lack of progesterone, which usually happens after ovulation, will lead to this inside part of your uterus just continuing to get thicker and thicker over time. That means that you are skipping a period. Remember that period is a shedding. It thins out that inner part of the uterus. And so if you're not having a period, then this inside area becomes thicker and thicker and thicker over time. Now, in the event you do have a period, say in 2 months, imagine this. You may have a heavier bleed. You may have a period that lasts longer than it normally would because you have all this additional built up tissue on the inside part of your uterus. And so it is very common in estrogen dominance to not have irregular cycles. With that, you may also develop other conditions like PCOS and all the different hormonal things that can happen when you have an estrogen dominant status. We also know that while these hormonal imbalances are happening, we may also have insulin resistance or an excessive amount of insulin being released into your body as well. Now, in general, this is not a good picture because this may lead to you having more fat storage, which is opposite than what you would like because you want to release more fat cells, not create them. And so having insulin resistance may lead us to a place where we feel like we're stuck in a tight place where we don't have many options and things are just not working to help to lose weight at all. If you've been trying to get pregnant and you're not able to do so, or you haven't been successful, and you think that this could be due to having excess estrogens in your system or having a hormonal issue, it is often really helpful to, one, identify the reason why you're having a fertility issue. If this is hormonal, we can make changes and make adjustments to help to improve the hormonal functioning of your body. If this is due to PCOS, we want testing and a diagnosis so we can make the appropriate management and treatment plan. If you're just overweight but you have no other symptoms but you would like to improve your fertility, the recommendation is losing about 5 to 10% of your weight. Now, that may sound like a lot, but depending on the person, it may not be as much as you may think. So if you're 200 pounds, for instance, 5% of your weight may be 10 pounds. If you can create a plan wherein you can lose 10 pounds, if you are 200 pounds, you can see a significant increase in your fertility. It's actually quite amazing, and it's a part of the reason why people who are taking certain medications these days to help them lose weight, they at one point thought they were infertile, and I can't tell you the amount of pregnancies that we're seeing now because of using GLP-1 medications, for instance. People are having babies left and right now because they're losing so much weight that it's actually increasing their ovulation and fertility and their ability to maintain a pregnancy when it occurs. And so losing weight can absolutely help. The goal is to try to lose 5 to 10% of your current weight. I'm just going to throw in there, since we're talking about this topic, and it's very much specific to females because my channel is primarily females, but did you know that males can actually benefit from weight loss? It is actually quite astonishing because sperm and its production as well as functioning improves dramatically when males who are overweight or obese lose weight just the same. When we're thinking about fertility, this is not a one-way street, it's actually a two-way street, and either person being overweight can impact their fertility as a couple. So just something to keep in mind as well. Now, some of the best recommendations that I have for you when approaching fertility is first to make sure that our nutrition is up to par. We want to make sure that we're eating nutrient-dense foods, we're fiber-filled, we're eating lots of protein, we are decreasing processed and refined foods, we are encouraging lots of water intake, and all the things, less sugars. I mean, I could go on and on and on about the things that we can do to help when it comes to nutrition. But in addition to that, we want to make sure that we're moving and exercising and doing the things that will help to decrease insulin resistance. It also means that if you are struggling with the process, do not be scared or nervous to involve the experts. That could be a trainer, that could be a nutritionist, that could be your OBGYN. This could be an infertility specialist. There are resources available. It's just a matter of tapping into them and having that direct conversation about what your concerns are and what your needs are. And of course, it also means considering things that are not necessarily as typical, from surgery to medicines. There's just so much available to help you. Now, because you've been listening, I would like to offer you a free copy of my ebook, hormones don't lie. In this ebook, we will dive into more details about the things that you can do to impact your fertility, impact your hormonal health. And listen, I'll be so happy to send you a copy of this ebook. Click the link in the description. I'll send it your way. Thank you so much for being here today. Thank you so much for listening in. I'll see you next time.